Good morning, everyone. Welcome to Substeam Session 4. This is the second session of this theme, and I am Gerardo Segura from the FAO organizing team. I would like to give you a warm welcome and thank you for being here and the patience to help us coordinate this very complicated hybrid session. I just want to introduce our moderator, Professor Dong-Myung Peek, Professor of the Department of Environmental Health, Seoul, and this is the National University School of Public Health, South National University, Republic of Korea. Thank you for helping us coordinate this session and moderate it.
Thank you. Well, as introduced, my name is Dong-Myung Peek, and I will moderate this session, number 2. Now the time is 11:02 until 12:30. We have about 90 minutes of time with 1 keynote speakers and 5 panelists. This session is for Forest for Human Health. So trying to explore the relationship and meaning and implication of the forest in regard to human health. Next slide, please. So if we think back, long time ago, forestry was kind of the home and workplace for humankind. And this kind of environment, nature, has changed for hunter-gatherers to nowadays city dwellers. And these changes in forestry is in terms of the existence and exposure to the greens and experiences and effects and implications in different areas of human health. And I think in some way we can sum up the forest as a healthy green, but also forest as a healing and therapy. And beyond that, forest can be a part of the one big global health, One Health. So these are different kind of perspectives, topics. And next slide. And we will talk about each one of them, kind of, I guess, not in detail, but briefly. For example, for issue number 1 as existence, the greens can mean different things. It can be forest, or it can be park, just garden, or indoor greens, or just kind of screens with green pictures. So what is the essence of the greenness as an existence? Can be different from one place to another. Next slide. And for the exposures and experiences, which green is important for human health and also for our living and experiences? What activities in that green means something for the human health? So that those kind of things we still have to kind of explore. Next slide. As for the effects, we know forest has effects on our life and health, but we are not sure about its mechanism. What is the mechanism of the forest in terms of the health events in our body and mind and our relationship? And for example, often the immune and autonomic nervous system functions have been studied in addition to mental health. And all these, the immune function, autonomic nervous function, and the mental health are related with the brain. Then can the effects be related with brain rewiring or the way we appreciate and respond to the nature? And these kind of issues will need to be considered. Next slide. And as for the implication, what will be the future of greens in terms of the connections to others and other surrounding environments? And ultimately, the ecology, green and sustainable relations will be important. And can it be summed up as an all-in-one health concept? Those things we need to explore. Next slide. So this session is organized with one keynote speaker, Professor Maxine Whitaker. I'm sorry, I'm not kind of familiar with the name, so may pronounce it somewhat incorrectly, but she is co-director of World Health Organization Collaborating Center of Vector-borne and Neglected Tropical Diseases. And Professor Whitaker will talk about human health and forest, a public health perspective. And we have 5 panelists. First, Dr. King Lee, who is a physician and immunologist in Nippon Medical School Hospital, Tokyo, Japan. And we'll talk about forest medicine as a kind of forest therapy. And the second panelist, Professor Won-Sup Shin, who is professor of Chungbuk National University, was the president of Korea Forest Therapy Forum. We'll talk about the implementation of forest healing in Korea. And panel number 3, Dr. Francesco Riccardo Beccari, who is a founder and scientific director, Pian dei Termini Forest Therapy Station in Italy. We'll talk about integrating forest therapy in public health, data knowledge, and information sharing. And fourth panelist, Dr. Adamek, who is head of IM, Institute for Forest Medicine and Forest Therapy in Germany. And we'll talk about practical approaches and the role of professionals and stakeholders in promoting forest medicine and therapy. And last panelist, Dr. Ikovic, who is a senior scientist and leader of sustainable landscape and livelihood teams, will talk about forest for healthy and sustainable diets. So it will cover different areas of forest and human health issues. And the keynote speaker will have about 10 minutes of time, and the rest of the panelists will have about 7 or 8 minutes of time. And after we hear all different aspects of the health issues, then we will try to discuss in diverse order. Actually, I guess in that order. So in the discussion session, I will ask speaker and panelist to try to kind of respond to the comments and also ideas of other presenters. So, and at the end, we would like to kind of wrap up for this session in terms of what we can do from now on further. So, I had explained a little bit in length, but so that's our session, and I guess now we would like to have the keynote speaker, Professor Maxine Whitaker.
Thank you. If I could have my slides up, please. And while those slides are coming up, I'd like to thank the organisers for inviting me to participate. I note also the contribution of Miss Anna Dwan, a James Cook University student, to the literature search that helped me with this paper. I acknowledge the traditional owners of the land from which I speak today, the Gubbi Gubbi people, and I pay respect to their leaders, past, present, and emerging, and acknowledge their deep knowledge of living sustainably on and caring for planet Earth. I also acknowledge any traditional leaders listening to this paper. On the next slide, I show the four main themes I'll have today, and I've really taken the perspective of the context of forest dwellers and those who work in forests in low and middle income countries. Next slide, please. Forests are a source of food and nutrition for many who live in the forests, with strategies for sustainably obtaining foods based on forest biodiversity and therefore dietary diversity. Barks, gums and resins, fruits and nuts, roots and tubers, stems and plant extracts, infusions from plants, fungi, insects, animals, a full smorgasbord. A study in northwest Thailand found that over the year, half the food eaten by the 3 studied communities was forest derived, a total of 126 foods. However, biodiversity and dietary diversity is essential to avoid nutritional deficiencies occurring. Conversely, strong indigenous knowledge of these forest foods can be used to address nutritional deficiencies. Forest foods can also generate income through direct sale of forest products, as well as for agricultural purposes, supporting food-producing animals of the families. There's a strong and deep sense of connection by humans with other living beings, called biophilia. This relationship is an ecosystem service of the forests. In Australia, the Victorian Parks Plan identified the health-promoting role of natural areas based on links with the protection of mental health, promoting critical thinking and cognitive abilities, and supporting life coping in adolescence. Other data has shown the role of green spaces in reducing the drivers of biological aging in humans. Medicinal plants are one of the provisioning ecosystem services of forests, and many cultures have a long history of using them as products for healing. The World Health Organization has estimated that 70 to 95% of people in low middle income countries rely on herbal medicines as their primary health care, from amongst more than 70,000 plant species estimated to be used for such purposes. At least 25% of modern medicines are derived directly or indirectly from medicinal plants. But not all traditional remedies may be efficacious, and some can even be toxic, and the dose of the medicinal compounds may be unpredictable. Many health systems practice an integrative health system, where Indigenous health providers work in primary healthcare systems and use traditional health products. People already practice pluralism. They seek care from traditional healers alongside biomedical providers. And policies to support integration exist in many countries. Forests play a major role in keeping the water we drink, the air we breathe, the climates we live in available and safe for our health and well-being. They help protect against many natural disasters and support the health of our soils and therefore food production. Forests are a major component of the social, cultural, and spiritual lives of humans, especially Indigenous populations. Insects, venomous, and other animals can cause ill health amongst humans. 60% of the emerging infectious diseases are zoonotic in origin, and 70% of these are from wildlife. Direct contact, indirect contact, food, water, and vector-borne routes are the major ones of transmission. This zoonotic nature of infectious diseases lends itself to the One Health approach, to which I'll refer later. Working in forests is one of the most hazardous workplaces for human health, and guidance has been provided to ILO constituencies to improve safety and health performance of national forest enterprises. However, not all people working in forests are part of a regulated industry. These unregulated jobs are often availed by the poor or migrant workers who may have little understanding of risks and rights and have little option but to work there to earn money. Many forested areas are also contested zones with fighting, criminal activity, and forcible displacement of Indigenous people as major safety and security concerns. Next slide, please. People who live or work in forests have particular risks and vulnerabilities, often shaped by the social, economic, cultural, historical, colonial, and environmental determinants of health and well-being. Many of these live a subsistence lifestyle. Living conditions may be poor, overcrowded, poor water and sanitation, limited access to health services and information. And women in these settings often have limited autonomy and limited access to health and education services. And their gender proscribed roles, like collecting water, may create particular risks of exposure. Next slide, please. These communities are usually neglected by routine health services, which find them geographically harder to reach because they speak different languages and have cultural practices that they may not understand or even respect, may be stigmatized, with whom health service providers don't want to be associated, and may be mobile and hard for routine services to find. These populations suffer from infectious diseases that are not common in the routine health services, and health staff may not be trained to, nor health services equipped to diagnose and treat them. These people are often called unreached populations, whom the Sustainable Development Agenda says we should not leave behind. Next slide, please. There are many ways of addressing the needs of people in low and middle income countries who live and work in forests. A critical element of this is to examine what services do reach people and identify what value can be added to these services. A One Health approach provides an avenue for using human, animal, plant, and environmental services to provide access to human health services. For example, using community-based forest or conservation officers to promote human health, refer people to human health services, and provide first aid. The ICRC model of community-based surveillance for infectious diseases brings together officers from animal health, agricultural extension, conservation, with community members and local human health staff to identify early warning signs of an outbreak and try to minimize spread. And sharing resources like transportation for people or goods with human health services can allow outreach health teams to increase access. Next slide, please. One example is in the Greater Mekong subregion where I work. In the last kilometre for malaria elimination, it is mainly mobile and migrant populations at the borders who have malaria. Understanding these populations and what services reach them and their exposure to malaria is critical information provided by many sectors, with the affected populations themselves, the experts of their lives involved. So a One Health approach adds value in understanding the risk posed or created by changes at these interfaces, and which can help prevent or mitigate the impacts on human health. Next slide, please. So in summary, I've focused particularly on people living and working in forests in low and middle income countries. Often these populations are neglected by routine services, policymakers and planners. Understanding the underlying determinants of their health and well-being assists in developing approaches to reduce risks and vulnerabilities to their health. A One Health approach, including the transdisciplinary nature, having communities as equal partners and experts, and working at the animal, human, environment, plant interface, enhances the identification of these risks and vulnerabilities and finding appropriate, sustainable, resilient approaches to addressing them. Integrating the health and well-being promotion aspects of forests into human services will also help ensure that the Sustainable Development Goal 3, good health and well-being for all, and leaving no one behind, is reached. Thank you.
Thank you, Professor Whittaker. Professor Whittaker have presented the forests not as just a kind of occasional visiting place, but as a kind of workplace and living place, and try to kind of introduce us how we can approach the forest for those people who are working as well as living inside, and also including the people who are using the forest from outside, and provide a concept of One Health, integrating the human, animal, environment, and social, and into big tent. Thank you. And also, we will discuss about the concepts and also relations in the discussion section. And now we would like to turn to panelist Dr. Qing Li. I know Dr. Qing Li is online, but had provided us kind of pre-recorded presentation. So I guess first we would like to kind of have that presentation played, and then we will invite Dr. Qing Li to participate in the discussion.
Hello, everyone. Good morning.
Good morning. Yeah. Okay. So can we have the pre-recorded presentation?
Yeah, I sent the video. Okay. Morning. I'm Dr. Qing Li from Nippon Medical School. I'm also the president of the Japanese Society of Forest Medicine, the vice president and secretary general of International Society of Nature and Forest Medicine, and the director of the Japanese Forest Therapy Society. Today, I will introduce the forest medicine. What is forest medicine? Imagine a new medical science that could let you know how to be more active, more relaxed, healthier, and happier with reduced stress and reduced risk of lifestyle-related diseases and cancers by visiting forests. This new medical science is forest medicine. Forest medicine studies the effects of forest environment or home health, and is a new interdisciplinary science belonging to the categories of alternative medicine environmental medicine and preventive medicine. Forest medicine is developed from forest basin of Xingling Yoku and forest therapy. It is evidence-based preventive medicine. I have published forest medicine in the US in 2012, and this book has been translated into Chinese in 2013 and translated into the Korean in 2017. So we have established the new medicine, forest medicine. What is Xingling Yoku forest basin? Researchers in Japan have tried to find a new method to reduce stress by visiting forests and have proposed a new concept called the Xingling Yoku or forest bathing. Xingling in Japanese means forest and Yoku means bath. So Xingling Yoku means bathing in the forest atmosphere or taking the forest through our senses. This is not exercise or hiking or jogging. It's simply being in nature, connecting with it through our sense of the sight, hearing, taste, smell, and touch. Xingling Yoku is like a bridge. By opening our senses, it bridges the gap between us and the natural world. How to enjoy forest bathing Xingling Yoku? People can enjoy forest bathing through 5 senses. Sense of the sight, green color, yellow color, forest landscape. Sense of the smell, special good smell, fragrance, phytoncide. Sense of the hearing, forest sights, bird song, the murmur of stream. Sense of touch, touching trees, put your whole body in the forest atmosphere. Sense of the taste, eating food from forest, taste the fresh air in forest. The first Xingling Yoku forest bathing study in Japan, even in the world. In 2005, I conducted the first Xingling Yoku study in Iyama, Nagano Prefecture, Japan. And the result was published in 2007 in this journal. The terms of the forest bathing and the Xingling Yoku in English were first used and defined in this paper. The second and third Xingling Yoku forest bathing studies in Japan. The sustained effect of Xingling Yoku. In 2006 and 2007, I conducted the second and third Xingling Yoku studies in Agasawa, the birthplace of Xingling Yoku in Japan, and Shinano-tao, Nagano Prefecture, in both males and females, to investigate the sustained effect of Xingling Yoku, and the results were published as follows. This is for males, this is for the females. I will introduce some results of my research. The first one is Xingling Yoku increased NK activity, and this effect lasted for 30 days in both males and females. NK cells are immune cells, can kill tumor cells. This NK activity before day 1, day 2, day 7, day 30, male and female. Next, I will talk about the immune function Xingling Yoku and COVID-19. Elderly people, patients with underlying disease such as diabetes, hypertension, heart disease, and respiratory disease are easy to develop COVID-19 and become more severe, and the mortality rate is also higher because of the reduced immune function in the patients. Therefore, immune function is very important to prevent COVID-19. Xingling Yoku may have preventive effect on COVID-19 by boosting immune function. This figure shows that Xingling Yoku reduces the score of the anxiety, depression, anger, fatigue, confusion, and increase the score of the vigor, indicating that the forest bathing may have preventive effect on depression. Xingling Yoku also can reduce stress hormones. This is mental stress and physical stress before the forest bathing, after forest bathing. Big reduction in mental stress. Next, I will talk about the mental stress Xingling Yoku at the outbreak of COVID-19. Mental stress and various mental disorders due to lockdown and isolation are also major social problems. Xinling could reduce the negative emotions, mental stress, and stress hormones, and increase vigor at the level of the serotonin serum. Therefore, Xinling may have preventive effect on COVID-19 induced mental stress and mental disorders. Next, the effect of the forbidden on blood pressure. This is blood pressure, SBP, DBP. Before the forbidden, after forbidden. This line shows the CT walking. This line shows the forbidden. So you can find Xinling could reduce blood pressure compared with CT walking. Blood pressure was decreased about 7 to 8 mmHg by Xinling. This one. So, in fact, patients with underlying disease such as hypertension and heart disease are easier to develop COVID-19 and become more serious. Xinling has preventive effects on hypertension and heart disease to prevent COVID-19. The benefits of forbidden Xinling. Forbidden boosts immune function. Forbidden reduces stress hormones. Forbidden improves sleep. Forbidden reduces the activity of sympathetic nerves and increases the activity of the parasympathetic nerves. Forbidden shows preventive effect on depression. Forbidden reduces blood pressure and heart rate. Forbidden may apply to rehabilitation medicine. Forbidden in city parks also has benefits on home health. Forbidden has a preventive effect on lifestyle-related diseases. Forbidden shows preventive effects on COVID-19. Let's go to Xinling to overcome COVID-19. Thank you very much for your attention. This is my book, Forbidden in America, Xinling in the UK, Xinling in Italy, Forbidden in Korea, Xinling in Japanese, and into the forest, forbid into the forest, Xinling in Chinese, and Xinling in Spanish. Bye-bye.
Thank you. Professor Qing Li had introduced forest bathing concept and practice in Japan. And I think I have learned a lot from the Japanese practice. The next panel will be Professor Won-Sop Shin, as I introduced, who is professor in Chungbuk National University, and he's president of Korea Forest Therapy Forum. And can we have, yeah.
Thank you, Professor Beck. Good morning and good afternoon, good evening, wherever you are staying. And ladies and gentlemen, it is my great pleasure and honor to be here to share the forest and human health experience in Korea. This morning, I will share some of my and Korean experience of forest and health. Like other countries, the public and personal health is typically hard hit by severe pandemic situations in Korea. However, the pandemic situation in Korea also provided some challenges in the area of forest and human health. I'd like to share these challenges and Korea's experience using the forest for human health. The next slide, please. As you see these very simple black and white pictures, it's called Rubin space, the famous pictures in cognitive psychology. As you can see from these very simple pictures, and if you see the black part, and also you can see the white part, the meanings of these pictures are quite different. So on the, it looks like a base or it looks like faces. Even though this is very simple black and white pictures, it gives you very, very different images depending on which part you are focusing to see. Like this picture, the forest has a different function and value. As keynote speakers already mentioned, there's lots of tangible and intangible benefit from forest. So that's why sometimes forest management is very complex and complex for coping with the different interest groups or stakeholders. Next slide. Yeah, this is a taxonomy. So we already mentioned about the benefits from forest, tangible and intangible. And all of them are influencing on humans' well-being and the qualities of life. Recently, among the forest benefit, the therapeutic or health benefit from forest are emerging because our society is getting industrialization and urbanization. All of us know already the urbanization is a double sword. It provides lots of opportunities such as economic development and gain, job, and the convenience of living. However, the urbanizations also make people far away from the traditional relations with nature. Next slide, please. This is a cover of special issues of Science published in 2009. A title. The titles of the edition is The Right of Human Origin. The cover page in the special issue reported the result of investigation of remains from Awashi River in Ethiopia. A group of scientists concluded that the remain was a lady nicknamed Aldi. The next slide, please. Who lived in the area about 4.4 million years ago. Very, very long time, cannot imagine. Even further, the scientists argue the first ancestors have lived in savanna types of forest from 6 to 7 million years ago. And even just 5,000 years ago, they came from the forest to form early types of society and starting cultivation and raising animals. Therefore, all portions of our human history is a history with the forest and in the forest. So we remain living in modern society, have the same gene with our ancestors living in the savanna, like Aldi. This is the theory of biophilia developed by Edward Wilson in Harvard. Next slide. Before talking about the main topic, I'd like to share some fact of Korean forest. Korea is a forested and mountainous country. We have about nearly 64% of forest land, our total national land. And most of the forest area owned by private. Only 25% of the forest owned by central government. The large portions of private forests are sometimes hurdle to manage forest, mainly because private owners have small portions of forest and don't have any interest to manage their forest. Next slide, please. This is the graph showing that the growing stocks of Korean forest is increasing, even though the forest areas are relatively decreasing now. As you can see from the graph, the Korea has bare forest land only a half century ago. Now, Korea is admired as a successful restoration of forest country in the world. The Korea has about 165 cubic meters of growing stocks per hectare. Next slide, please. With this abundant forest resources, Korea is trying to deliver health and happy to the public through forest. There are several reasons why thus forest therapy and using forest for human health needed and important in Korea. The first, as I mentioned before, we have abundant forest which can be accessed anywhere and anytime in any places across the continent, across the peninsula. Second, traditionally, we Koreans have lived with the forest harmoniously. In other words, forests are always part of our life, and using forests are routine our life. The third, the Korea is the country which has rapid economic development. The rapid development growth has a dark side, such as a high competition, high urbanization rate, and a high density of population. Next slide, please. The economic development and urbanization provide some opportunities, such as job creation. However, as I mentioned before, the result of the effect, the people in urban area are far from the traditional harmonious relations with the forest. And lastly, the country, Korea, is getting super aging society. So forest resources can play an important role as a preventive medicine for public, especially for senior population. To implement forest as a public health and people's welfare, the Forest Welfare Promotion Act was proclaimed and effected in March of 2016. So this is a landmark legislation to improve people's health and happiness through and using forest across the country. This legislation, as far as I understand, is the first case in the world to use forest as a people's well-being resources. Next slide, please. The forest policy, titled Forest Welfare with People's Life Cycle, is a flagship policy of forest and health and welfare in Korea. This policy's purpose is to provide tailored forest welfare services and facilities according to the people's life cycle. For example, from the birth to death, forest service program and the facilities are provided for any stage of people to increase their health and happiness from forest. From the cradle to the grave, happiness should be delivered with this icon policy. Next, please. As I mentioned before, the Forest Welfare Promotion Act make possible to designate the therapeutic forest or the healing forest center and forest therapy center to spread forest therapy into public by Korea Forest Service. So far, there are 37 forests designated and run by central, local government, and private. So this is a map indicating 15 locations of therapeutic forests run by central government. Next slide. More broadly, this map also showing the comprehensive locations of forest therapy centers which are running and under the construction in Korean Peninsula. The green dot indicate national forest therapy centers, and the reds are public or private center, and the blue dots are under the construction. So altogether, nearly 70 forest therapy facilities would be run across the country in the couple of years. Next slide. To combat increasing demand for using forest for public health, Korea Forest Service announced many strategies of forest management for post-pandemic and disease prevention. Among them following are some ambitious projects. The first, the plan to increase numbers of people using forest therapy participation. Last year, there are 18,000 of people participated in forest therapy program in Korea. The goal of participants was this year is 26,000. The second, plan to increase average of using day in forest therapy from 6 to 8 days per capita. Third, the plan to increase supply of forest welfare facility. There are around 2,135 places running, including the therapeutic forest. According to the plan, the government tried to increase the facility to 3,683 places. Lastly, the plan to increase numbers of people using forest welfare voucher. The forest welfare voucher is issued for economic and socially vulnerable people for using the forest welfare facility and services without any the financial burdens sharing. Last year, 1,040,000 people benefited. The Korean government planned to increase double numbers of people who benefit this year. Next slide, please. So far, I introduced some strategy and plan about the forest and human health in Korea. Korea is the country standing in the front line for using forest for public health and welfare, and I hope our effort resulted fruitfully for people's health and happiness through and using forest. I think, however, the forest and health is still a black box. That means we all know the forest provides health benefit. Nobody doubt. But we still don't know the large portions of mechanism, why and how forests provide this health benefit. So research on this area are significantly important to implement forest therapy in many practical areas. The Chungbuk National University, located in the middle centers of a province in Korea, has a unique graduate department to contribute this evidence-based research on therapeutic benefits from forest. The pandemic, unprecedented, has put dampers on everyday life in every aspect. However, the people's interest and the desire to use forest for health are getting stronger than ever. The COVID-19 pandemics we have experienced is deepening our concern regarding the importance and the utilizations of forest in relation to our health. In post-COVID era, the role of forest, especially in the area of health, will become greater and more significant. Thank you very much for your attention.
Thank you, Professor Shin. To those who are from outside of Korea, actually the Forest Therapy, Forest Welfare Center in Korea is very popular. And I even tried to make an arrangement, but every time it's very difficult to get a time slot. So, it's thanks to the people like Professor Shin. And the next panel, I guess we would like to just continue the panelist discussions. And at the end of the discussion, we would just repeat the discussion in later time. So panel number 3 is from Italy, Dr. Francesco Riccardo Beccari. And I know Dr. Beccari is here, so please.
Good morning. My name is Francesco Riccardo Beccheri. I am psychologist and psychotherapist, founder and scientific director of the Forest Therapy Station in San Marcello Piteglio, which is a public heritage that I have the pleasure of managing on the Tuscan Apennines. I'm also a psychologist referent for the Italian Alpine Club. It is a public body, and its purpose is to promote mountaineering, knowledge and study of the mountains, defense of the natural environment. In particular, I work with Central Scientific Committee and Central Medical Commission. Let me thank to FAO and Korea Forest Service for inviting me to this important congress. I'm honored to be here with you. Next slide, please. Here you can see a brief summary of our work from 2019 to 2022. Especially, I would like to tell you about a local project like the one I developed in Pian dei Termini. Next slide, please. In 2019, became a national project until the signing of an important national agreement in 2022, with the aim of scientifically qualifying green areas in terms of effect on human health. Next slide, please. In 2019, we started a pilot study in Pian dei Termini that involved 15 people for 3 hours and demonstrated a significant reduction in anxious activation, a reduction in maximum blood pressure, and regularization of HRV. Next slide, please. During the COVID emergency, our work did not stop. In March 2020, a few days after the start of isolation for the International Day of Forests, I made a video called A Health Pill for Emergency, a contemplative immersion in natural context to get as close as possible to the in vivo experience that was precluded to us at that time. With this video, we have carried out a scientific research together with Professor King Lee, the National Research Council, and the Neuroscience Department of the University of Florence. Next slide, please. This study investigated the effectiveness of a simple and affordable remedy for improving psychological well-being based on audiovisual stimuli brought by a short computer video showing forest environments, with an urban video as a control. Next slide, please. Randomly selected participants were assigned to the forest or urban video to look at and listen to early in the morning, and questionnaire to fill out. Next slide, please. The virtual exposure to forest environments showed effective to reduce perceived anxiety level in people forced by lockdown in limited spaces and environmental deprivation. Although significant, the effects were observed only in the short term, highlighting the limitation of the virtual experiences. The reported effect might also represent a benchmark to disentangle the determinants of health effect due to real forest experiences. The inhalation, for example, the inhalation of biogenic volatile organic compounds. Next slide, please. In 2020, the National Research Council and the Italian Alpine Club published the book Forest Therapy, of which I am co-author. In Italy, this publication is very important because it represents the first scientific synthesis of knowledge about forest therapy. Next slide, please. Just 1 second, sorry. Again, in 2020, we have conducted an experimental study which aimed to prove forest therapy effect on the mood state of anxiety, depression, anger, and confusion. 7 forest therapy sessions were performed in remote areas and control 1 in urban park. Next slide, please. with participants allowed to attend only one session, resulting in 162 psychological self-assessment questionnaires administered before and after each session. Meteorological comfort, the concentration of volatile organic compounds in the forest atmosphere, and environmental coherence were identified as likely important external and environmental variables. Under certain conditions, forest therapy sessions performed in remote seats were shown to outperform the control session, at least for anxiety, anger, and confusion. Next slide, please. Next slide, please. In 2021, we have started out our current project between Alpine Italian Club, National Council of Research, and Regional Reference Center in Phytotherapy of Correggi Hospital in Florence. This project has three aims: promote the forest therapy taken by the National Health Service as a preventive medical therapy, with results in psychophysiological terms confirmed by a growing scientific production. Define all the aspects that the forest therapy station must have in order to create a single reference standard to be applied at the national level. Create a network of qualified forest therapy sessions, mainly, but not only, at K refugees located in forest areas along the Alpine and Apennine ranges. Next slide, please. With the aim of being able to compare experiences conducted by different therapists, we have defined a method by which experiences in the forest are conducted. It is simple, structured, and interoperable. Faithfully reproducible by different therapists, adaptable to different environments. It encourages the exploration of nature through the senses and the immersion of the individual. Next slide, please. After we have trained about 30 psychologists, psychotherapists, and dozens of CAI forest therapy operators. Through this method, and thanks to the professionals and operators involved in 2021, we have conducted an experimental campaign. Next slide, please. With 40 forest therapy sessions all over Central and North Italy, 855 participants, numerous controlled sessions, single TVOC and BVOC measures, POMS and style questionnaire, detailed socio-demographic information, physiological HRV and saturation measure. This data and analysis are still in progress. Next slide, please. To conclude, the original partnership between CAI, CNR, CERFIT in 2022 has expanded thanks to an important research agreement with prestigious national institutions and research bodies, with the objective, among others, of standardizing the method of exercising forest therapy and concluding the transition toward integration within the public health service. Next slide, please. Being here today is a great confirmation that working on the enhancement of professional skill through a multidisciplinary approach based on data is the best way to continue. We are very proud of this achievement, and we hope it will make an important contribution to make the role of forest increasingly central to human health. Thanks for your attention.
Thank you. Thank you, Dr. Beccari. I guess in Italy also, COVID-19 was a kind of turning point to look at the forest as from different angles. And I guess you have been trying to open the black box, how the forests can change the human health in what mechanism. And we all try to understand that. And I guess we should continue the panel discussions to be in time. And the first panelist is Dr. Adamek from Germany. I know Dr. Adamek provided us a pre-recorded.
Hello.
Oh, hi. Hi. So, okay. So can we have Dr. Adamek presentations?
Hello, my name is Melanie Adamek. I would like to thank the organizers for inviting me to this exciting Congress. I am very happy to share experiences and excellence with so many renowned experts from different fields of science and practice. Hopefully we can meet again soon offline and live, because especially our topic is not about something abstract, but it's about sharing and collecting experimental knowledge, and it's about networking. Promoting forest medicine and therapy in a contemporary world is a very broad topic that it's hard to cover in 8 minutes, and therefore I will concentrate on some key points, and above all, I would like to give you an insight into the practical work of our institute and in our vision. The Im Waldsein Institute for Forest Medicine and Forest Therapy is an interdisciplinary association of people who are committed to the application and development of evidence and science-based forest medicine and forest therapy. With our commitment and our programs, we contribute to establishing forest therapy in German-speaking countries as health politically significant instruments of a modern prevention and health strategy. Our vision: people staying and becoming healthy with the help of nature and a modern healthcare system that supports them in this aim. We have 8 departments that focus on different target groups. Our office are target group specific, setting related and effectiveness tested. They motivate people to adopt a naturally healthy lifestyle that is easy to implement, increases vital energy and enhances quality of life. Our content, methods and services are based on evidence and on active partnerships. And all of our solutions respect and support people in their individual approach to nature. Our modern world often leads to an unhealthy lifestyle. This creates psychological stress and lifestyle diseases. When it comes to our health, we humans tend to be lazy. We want the easy solution, the pill for everything, and often we overlook the obvious. For a lot of stakeholders, forest therapy seems to be too simplistic. But there's also hope. A lot of people are longing for nature. They have a desire for a simpler life, less complexity and more naturalness. In the medical field, this desire is expressed by an increased demand for complementary or alternative forms of treatment. What are the typical challenges in establishing forest therapy? Forest therapy is unfamiliar to many healthcare stakeholders or has an esoteric connotation. The cardinal problem with nearly all complementary medicine interventions and therapies is evidence, especially in the clinical setting. Another problem is budget constraints in the healthcare system. A wide variety of complementary therapies compete for a very tight budget. Whereas doctors in private practices do not prescribe forest therapy because they do not know the effects, they cannot recommend a reliable form of therapy and appropriate staff, and moreover, they have no way of billing the prescription. So what are the foundations for successful solutions in promoting forest therapy? It's legitimation through research and proof of evidence. It's pooling of knowledge and exchange. A lot of educational work. The creation of political framework conditions, and in our opinion, the cardinal component is, in a world flooded with offers, we have to pick people up where they are at the moment. We need services that are relevant to their lives and that are effective. In the public health sector, many interesting questions arise about effectiveness and feasibility of forest therapy interventions. However, quality assurance and quality routines play a significant role. Health promotion as strategic approach in the sense of the World Health Organization's definition means that people are enabled to shape the factors influencing their health themselves. The setting approach is central. Settings are designed in such a way that the healthier choice becomes the easier choice. With the headline, "From Cradle to Grave, Living with Woods," Korea found an amazing headline for their strategy. Speaking of forest therapy in medical care, we can state that in most countries, forest therapy has project character. Regular offers with regular routines have not yet been established. Ultimately, differentiated research will be necessary to cover individual case studies. The question of evidence is a very important one, but in practice, the question of compliance or the joy of regular practice ultimately determines success of medical application. Now it is important to adapt established treatment methods to today's requirements and new patient groups. Medical staff has a key role in selecting and instructing patient-adapted measures and evaluating them together with the patient. Post-COVID-19 health management shows us how important forests are becoming in context of complementary medicine interventions within rehabilitation centers. So, what are the conclusions? As a last point, I would like to present our practical approach using the example of a cooperation between our institute and Sana Clinics Sommerfeld. Our top expert training essentially consists of two components that ensure the successful implementation of forest therapy in everyday clinical practice. The first component is expert training for medical staff. The main learning goals are health effects of Shinrin-yoku by Dr. Ching Li and application of forest therapy according to the Imwaldsein method. Lectures and workshops in theory, self-experience, and clinical practice complete the program. The second component are top expert tools. These are tools to implement Imwaldsein top expert successfully and sustainably for the benefit of employees and patients. Empowerment tools are motivating to integrate health-promoting elements into daily routine. And central fields of actions are exercise, relaxation, and stress management. On this slide, you can see the various components of our training with medical doctors and medical staff. And here you can see how medical doctors from all important departments experience Shinrin-yoku together with medical staff in order to create the basis for successful integration into everyday work with their patients. And it's precisely this practical work that provides many positive wow effects.
Thank you, Dr. Adana. So we have actually learned a lot from different countries, how they practice and what they do for promoting these activities and so on. And the last panel is Dr. Ikowicz. And Dr. Ikowicz is, I think, online. And we'll talk about the sustainable diet and forest for healthy and sustainable diet. So after Dr. Ikowicz, we will get back to the keynote speaker, Professor Whittaker, to to kind of respond to different panelists' comments, and also briefly, and each panelist can add some more comments based on other panelists' ideas and the comments. So the last panelist, Dr. Ikowicz, please.
Hello, my name is Amy Ikowicz from C4ICRAF, and I'm going to be talking to you today about how forests are important for healthy diets. There are three main nutritional challenges in the world today. There are over 900 million people who don't have enough food to eat. So that's the classic malnutrition that most people think of. There are also, though, over 2 billion people who suffer from poor quality diets, meaning they don't have enough micronutrients, which are vitamins and minerals, which can cause many health problems. There are also over 2 billion people in the world who are overweight or obese. Fruits, vegetables, legumes, and animal source foods are important sources of micronutrients. On the other hand, staple crops like rice, wheat, and maize are important for providing calories, yet are relatively micronutrient poor. But it's staple crops that have long been the focus of agricultural and food policies, both at the global level and in many countries. What does all of this have to do with forests? This figure is taken from the high-level panel of expert reports on food security and nutrition from 2017 and shows some of the links between forests and trees and food security and nutrition. There are two basic pathways. The first, those are the blue boxes. The first are provisioning ecosystem services, which are the direct benefits that people get from forests. So that includes non-wood forest products, which are often referred to as wild foods. Especially important are fruits, insects, leaves, and wild meat. Forests also provide wood fuel, which is used for cooking to extract nutrients from food, and wood products, which along with non-wood forest products can be sold for income, which can then be used to purchase food. There are also non-provisioning ecosystem services that forests provide to food production. So that can be, for example, habitats for pollinators that can make agriculture more productive, water cycling, soil nutrient cycling, and microclimate regulation. These all can make agriculture more productive. So despite these benefits, in many places, forests are cut in the name of food security. And so forests are replaced often with fields of monocrops, like cash crops, or in this example, oil palm, or staple crops like rice, wheat, or maize. And as you saw from the previous slide, it can lead to more food, but it can also cost food. If we think about some of the potential benefits that forests provide for food and nutrition. So it's important to know what are the net benefits. In some various contexts over the last bunch of years, C4 and others have done research to look at these benefits and costs of replacing forests with agriculture. And not surprisingly, these differ by context. But there's some general patterns that we've seen in our work, which is that often we see traditional staple crops being replaced by global staples. So this is sometimes called the homogenization of diets, where traditionally there have been many staple foods consumed across the world, but these have been replaced by rice, wheat, and maize as the dominant staple crops. So we've seen this actually in our work. In this picture, we see sago on the bottom. This is from research in Papua. That's been replaced by rice in many diets over a relatively short period of time. We also tend to see more sugary foods consumed, more highly processed foods consumed. So those tend to be dietary costs, but we also see some benefits like increase in dairy consumption, which can be important, especially for young children, and increase in fat consumption. We see, though, declines often in fish consumption, and fruit consumption, and green leafy vegetable consumption. There's been an increase in research on these links over the last decade. So here are some key publications, including 2 high-level reports. The first is the Global Forest Expert Panel report from 2015, looking at the links between forest, trees, and landscapes in food security and nutrition. And the second is the high-level panel of expert report that I mentioned earlier. Despite this increased attention and research, though, there's still a lot that we don't know. The specific costs and benefits of replacing forests with agriculture vary a lot by the context. And so the ecological system is important, the economic systems, the access to markets, the culture and dietary preferences, the access to forests in terms of institutions, education, all of these can affect the nutritional benefits and costs. And there's an overall lack of data on how much forest foods are consumed, as well as the nutrients that they contain. So that makes it also hard to understand the specific things that we're giving up. In 2019, CIFOR and FAO carried out a small pilot project in Zambia to try to measure the importance of wild foods, especially forest foods, to diets. So it was a relatively small sample size of only 209 households, but they were in all of the different agroecological zones, so it was relatively representative. There were 2 main methods used. One was a 1-year recall of the quantity of wild foods collected and consumed to try to deal with seasonality. And the second was a 7-day food recall of both domestic foods and wild foods consumed in the preceding week. These are the different food types that were looked at. So there were 9 different food types, and there was relatively wide collection of many of these food types. Here I'm going to zoom in on the fruit results, and the fruit is the only food group for which there is an international recommendation. So we saw that wild foods were collected in almost all households across the 15 villages that were surveyed, and they comprised 68% of women's fruits consumed in a 7-day period, and contributed 25% of recommended daily intake of fruit. Considering that women were not consuming the recommended daily amount of fruit, the actual proportion was higher. So it's a pretty big contribution. In 2021, CIFOR, the Zambian Statistics Agency, and the Zambian Forestry Department carried out a nationally representative survey using those piloted methods. Those data are still being cleaned and analyzed, and soon we hope to have some results of the first national survey of wild food collection and consumption, and to be able to share some lessons learned from that work. So, zooming out to the big picture. It should be clear that forests are not the silver bullet and are not going to solve all the nutritional challenges in the world today. But what's important is to realize that cutting forests for food security can actually make diets worse for local communities. And in order to understand those potential costs, we need to have better measurement of the benefits of forests for food security and nutrition. And that will enable policymakers to value these benefits and take those into account when making decisions, especially land use planning decisions. In order to do that, we need data on what and how much people collect and consume. We need information on the food composition to understand at a nutrient level how much these foods contribute to diets. And we need data on the sustainability of harvesting these wild foods if increased consumption of these wild foods are to be promoted. Thank you very much for your attention.
Thank you. Thank you, Dr. Ikovic. I guess we have covered pretty much diverse topics. Today, Professor Whittaker kind of introduced us the concept of One Health, and Dr. King Lee introduced the forest bath or forest therapy as practiced in Japan, and also Professor Shin as practiced in Korea, and Dr. Beccari in Italy, and Adamek from Germany. And lastly, Dr. Ikovic kind of talked about the importance of the forest as a kind of food source or sustainable diet. So I guess I would like to go back to Professor Whitaker to kind of comment based on other panelist discussions. And then I probably because Dr. King Lee and Dr. Adamak are online, not in person. So those will go first to give the comments. And then if we have a remaining time slot, then we will go the others. Yeah. Professor Whitaker, please.
Yes, thank you. And thank you to all 5 panelists for fascinating papers. I've learned a lot. I suppose from my perspective, what we've seen is the links between forests and human health, particularly promotive aspects for mental health, well-being and nutrition being elaborated. And many have focused on those urban and high-income settings. So some challenges, I think, for the panelists, from my perspective, are what might be the implications of what you've talked about for forest therapy, for treatment, not just for promotive care, particularly for some of the other global pandemic, which is mental health, non-communicable diseases, and dementia. And secondly, what are the implications for low and middle income countries? Can they do something now rather than wait, as we've had to in high income countries, to realize what they've lost and try to grab it back? And finally, using a One Health approach, who are the stakeholders? What's the added value for them in working in some of these areas, particularly in the forest therapy? How do we respect traditional owners of those lands, and how do we show value for other stakeholders in working with us in forest therapy for human health? Thank you.
Thank you. Dr. Whitaker mentioned, kind of raised the 3 very important points about the forest as a way of approach. Yeah. The forest therapy has been practiced firstly in Japan and in the other countries also. So, Dr. King Lee, I guess, should have some much thoughts about how to do that in other parts. Yeah.
Thank you very much for inviting me to the session. Thank you very much for the all speakers. So I learned a lot of things from you. So we have different field on the forest. In fact, the stress is a key word to add the forest bathing and the forest therapy, forest medicine, because stress can reduce a lot of diseases such as cancer, including cancers, hypertension, and depression, heart disease. So because forest bathing can reduce stress, so forest bathing may have many benefits of home health by reducing stress. Also, forest bathing can boost immune function. In fact, the immune function is very important, especially in the COVID-19. I think you will learn a lot of news about the COVID-19, and the immune function. So I give you a take-home message. So let's go to forest bathing to overcome the COVID-19. Thank you very much.
Thank you. Not only COVID-19 and immune function, but the other panelists commented about effect on mental problems from COVID-19. I think that was important. Yeah.
Thank you.
Thank you. And Dr. Adamak, I think so. In Germany, the forest therapy is one of the kind of daily medical practice or kind of prescription?
No, it isn't. So we have a very long history in medicine, natural medicine, and but we don't have it in forest therapy itself. So forest therapy in Germany has a quite esoteric connotation, and it's even if we practice a lot in spa centers with nature, it's not forest therapy itself that we practice, and there's a lot of work to be done, still to be done, and nearly no one knows what's going on, for example, on this Congress, and a lot of people don't know which evidence already exists about forest medicine and the pathways. And it's very important to convince stakeholders and people of the benefits of forest medicine.
Yeah. As you mentioned in your presentations, I guess the training and communication with the other experts is important. Yeah. Okay. I know Dr. Ikowicz is not online, so I guess we can turn to the second and third panelist, Professor Won-Sup Shin. Now I understand that Korea has enacted Forest Welfare Act, and was that very helpful in kind of promoting this forest as a resource to the general population?
Yes, I already mentioned in my presentation, Korea has a landmark the registration called the Forest Promotion Act, and this kind of the act provide lots of the opportunity to having the health benefit to the public, and especially for the economic and socially the vulnerable the people. So this kind of the registration can also strong the concrete the basis for delivering the forest therapy system to the society and the public. And one thing for Korean experience is suggesting is the government leading project is quite the efficiency for rapid the spreading this benefit to the public. But we are thinking about the economic gain or job creation, etc., as the keynote speakers mentioned. So for industrializations or the privatizing for these kind of the forest welfare systems and therapy system can be also we are developing for lots of opportunity for economic gain for the local economic development. So that is one of the our homework in this area. And I also mentioned about the function of forest therapy. We discussed before at the discussion. I think I'd like to suggest two ways of forest therapy function. One is preventive. We have a forest therapy using for the health in health condition. And the other thing is a treatment function for forest therapy. So the stress management is kind of efficient for preventive the functions of forest therapy. and also the treatment for the disease control or the healing the functions of disease can be efficiently come into as a comprehensive medicine services. So those kind of the classification is quite a different have forest therapy program. So we think about these two functions of forest therapy.
Okay. Yeah. In Korea, the forest therapy is not yet integrated into clinical practice, but because of the act legislation, the general public can approach and kind of experience the benefit of the forest by themselves, by kind of choosing voluntarily, and so I think that's another way, I guess, to expand this field. And Dr. Beccari, I know you've been working on your project, and from the psychologist viewpoint, you mentioned about the baseline survey method, and what is your ultimate goal from this project?
Oh, I think it is very important to define which is the method by we experience forest therapy, because there are a lot of proposals. There is mindfulness, there is Tai Chi, Qigong, yoga, but we know we have to start from a baseline method to analyze which is the real effect and corresponding of our action. And so we started from a simple method. And now the analysis and the data is now still in progress, but that together with the professional skill, because the method is managed by psychologists, professional psychologists of psychotherapies, so it's healthy profession. It is very important to define and to reach the goal to put forest therapy, to bring forest therapy into the National Health Service.
Okay. Now it's time to wrap up, and I would like to go back to our keynote speaker, Professor Whittaker, because Professor Whittaker mentioned the forests was approached in traditional medicine also, and so One Health should incorporate traditional medicine aspects into a big picture. I think I can understand, I agree with that. Having the last comment from Professor Whittaker, I would like to kind of wrap up this entire session. Yeah.
Well, thank you very much. I think what I'm hearing is that we're actually going back and looking at, a lot of traditional practices. Many of these things are things as others have said, our ancestors, or still many indigenous populations around the world practice. And I think, learning from each other as we've been doing today, but also taking a One Health approach in, mutually learning from each other, respecting community knowledge and expertise, and also breaking down those boundaries and find how together we can actually, conquer many grand challenges of the world, and in this session, human health issues, by actually learning from each other and looking for solutions that are resilient, but also help look after planet Earth.
Okay, thank you, Professor Whittaker. So now the session number 2 is over time, and I think we should conclude from here. Thank you for attending the library session. Yeah.
Bye-bye.
Thank you.